Hello, my name's Deborah Jackson, and I am one of the faculty and instructors for the Pathophysiology course in St. Augustine and for the residential program. And I've been invited to speak to you about pathophysiology success strategies. So I'm going to share my screen, and I have about an hour presentation that I'd like to give you. And so we'll begin, and I have time at the end for questions, but also feel free if you have a question to go ahead and ask it if you'd like. So the first thing that I'd like to do today is just quickly go over the overview for the presentation and the objectives so that you understand the focus of what we're doing this evening. So when we look at the overview or intro, the first thing I'd like you to keep in mind is that pathophysiology is a very demanding 4-credit course. So it's very important to understand the objectives listed below. And so objective number 1 is to understand how the course is set up and how to be able to navigate through the pathophysiology course. And our second objective is to identify recommended strategies for success in the course. So the first thing that I'd like to discuss with you is the difference between organization and learning. And the two aspects relate to each other for success, but they're not exactly the same thing. And so I'd like to discuss that a little bit. So basically what I did was I kind of put in silos a little bit, components of organization and components of learning. And when we look at topics relative to being organized relative to the course, components such as time management, prioritization, concentration, motivation, even when to ask for help, or realizing that life events might impact your ability to learn, all kind of fall into the topic of organization. And then when we think about learning and test-taking strategies, we think about things relative to learning, such as how to navigate the course. Do you know how to learn? Do you know how to approach learning? And that it's really recommended that you study every day. And then the next piece to that is you've learned this information. Now, when you get to the test, what are your test-taking strategies? I want to share with you how to dissect and how to read a question, maybe how to select an answer. I'm going to encourage you to purchase or use a whiteboard or scrap paper and to come to the test rested, that even though sometimes we feel like we have a lot of balls in the air and things are very challenging and we don't get enough sleep, it's really hard for us to do well on a test or to even learn. So you do have to, as part of your time management, really build in some time for you to be able to recharge and to sleep. And so we're going to talk about all those pieces, because when we look at how our students are doing, some of these things, if you're not doing them well, tend to be pitfalls in your ability to have success in the course. So let's look first at time management. So when we talk about time management, we have to think about things having to be planned. So you're really going to have to plan everything out. I encourage you to use a calendar, whether it's a paper calendar or a digital calendar. You really have to make sure that you know when your due dates are, you know when exams are, you even know like what exams and what assignments, how they're weighted, so that you know how much content that you have to prepare for. And you really need a calendar to be able to sort that out. And then you want to develop a timetable for each week of the semester so you know how to prioritize. Because the last thing you want to have happen is you don't want to be cramming for an exam because you didn't start studying for it soon enough, or you didn't realize that maybe an assignment might take you as long as it did. You want to try to pre-plan for those things. And then I'm not sure that people really think about it that much, but when are your best times of the day for concentration? Because I'm going to encourage you that most people have, because of our biorhythms, we just have certain times of the day when we seem to click better than others. And so I'm going to encourage you to study the information that's most difficult for you during the time of the day when you can concentrate the best on it, so that you have the best study efficiency, if you will. And then you really have to make sure that you make time for yourself. You actually, this course and this curriculum, it's a graduate level allied health profession curriculum. Within that is the pathophysiology course. You're really almost going to have to pencil yourself in. You become part of your calendar. And you need to make sure that you're taking time for yourself, for your own well-being, as well as to keep yourself recharged, because that helps keep you motivated. So maybe some of these pieces you weren't thinking about, but there are all parts of organization, and organization is essential for this program. Does anybody have any questions about the organization, this part of the organizational piece? Okay, well, I'm going to talk to you a little bit more about some other things that sometimes I'm going to put in under organizational too, and that's making sure that you ask for help in time. I think sometimes students are hesitant to ask for help because maybe they're unsure how that might be perceived. And I really want to let you know that our university really is student first. And we really want the students to reach out to us if you feel like there's something that you need help with, whether it's your faculty advisor or whether it's someone in Student Success Services or even the instructor of your course. We're all here to work together so that your journey through our program, that we want to result in you becoming a licensed therapist. We all want to be part of that and work together. So don't procrastinate on that. If you think that you need some help, really feel comfortable in reaching out. And then remember that sometimes you don't realize how different life events can be impacting your ability to learn. If something's going on in your family or in your personal life, that can be a distraction. It can affect your concentration. It might even affect the amount of time you have to study. If you're, emailing someone or you're on the phone, you're trying to come up with a solution about a particular situation, and realize that that can really affect your performance in the program. So again, it may be just a different reason why you might want to ask for help or for assistance. So again, please realize that, and realize that we're here to try to help you with anything that might come up. All right, so that's really the organization piece of it. Is there anything in the organization piece that surprised any of you, or anything that you'd like to talk about further relative to that organization component? Okay, well, let's look at learning recommendations for success. And we're going to take these recommendations and focus on how to navigate the course. You've been in the course for a couple weeks now, so some of it you may have figured out, but I still want to highlight a few pieces for you that we know really lends itself to success for the student. I wonder if you actually know how you learn. So we're going to talk about that a little bit and maybe how you should approach learning, because sometimes this course just seems really large, and it is. And so you want to be as efficient as you can in how you study for the course. And in order to do that, you really have to think about how you're going to approach your own learning. And again, I'm going to encourage you to pencil in some time and make sure that you're studying every day a little bit of content associated with the course. And you're going to have to do that with all your courses because you have other 4-credit courses too. So you definitely don't want to get where you're cramming at the end. You have to stay up with the course material. So this is basically how the course is set up. So basically what it is you have 15 weeks in a semester. And so when you look at the course, you'll see that there's 15 learning units in the course. And you've probably noticed by now that when you look at this, in the left margin of Blackboard, you see units 1 through 15, and they're each listed with the topics. Here's an example of the first 3 units. And one of the things that you'll notice is that a unit's covered every week. So there's really 14 different units because that 15th week is actually finals week, and the examination is given during final exam period of the 15th week. And then what you'll notice is that when you look at the course assessment, you're going to be assessed in the course through examinations, quizzes, assignments, discussion boards. It really depends on the campus, and it depends on whether you're in the residential or flex program, exactly how the course is laid out and rolled out. So, you might see some individual differences on that, like I said, across the programs and the campuses. And then what you will notice is that the course instructor or instructors will meet with the class through either in-person or virtual class sessions. And again, that's going to vary by campus and program. So, but one of the big commonalities is the course is a 4-credit course. And so some content is going to be needed to be learned asynchronously as part of this hybrid online program. So you're going to have to learn material on your own in addition to what you might be presented to from the instructor in a face-to-face situation. And when you look at Blackboard and when you look at your syllabus, we'll see that there are voiceover PowerPoints and digital lectures, and the time on each one of those is noted, and then it's all added up at the end of the unit. So when you come into that unit, you'll know exactly how much digital lecture time you'll have to allocate for your week for your asynchronous learning in addition to your synchronous learning. So when we look at this, you'll see that the course is set up with digital lectures. You have your unit learning objectives. I gave you an example of some Exam 1 resources and then the textbook. So the first thing, let's look at the voiceover PowerPoint lectures, or the VOPPs. All right, and you'll see that there also sometimes are other supporting digital lectures that are to help you direct and focus your learning. So one of the things that we did is each of the faculty members authored a particular unit. And so that's where you'll see the voiceover PowerPoints. But there's some additional digital lectures where some of the content seems maybe perhaps a little more difficult. So we went in and we found other digital lectures that could help support the content. so that you don't have to go around the internet and look for that. We found the digital lectures that we thought best reflected how we wanted to teach the course and how it was most relevant to physical therapy practice. Okay, so you shouldn't have to go search around the internet yourself. Everything should be all contained for you within the digital lectures. And you can see here that it'll tell you how long each digital lecture is and whether it's a voiceover PowerPoint that's maybe from one of our faculty as opposed to maybe something that we're making available that was a Khan Academy or Amoeba Sisters or one of those other type of platforms for digital lectures. The next thing I want to bring to your attention is the lesson, the unit learning objectives. It's important that you read these because it helps you focus on what we think are the important points and what we'll be emphasizing in this unit as the primary learning. And so that's one of the things that we're trying to do to help you is there's all this material. How do I kind of drill down and focus on the key points that are most important? One of the best ways to start that is to look at the learning objectives for each unit. The second thing that you can do is every exam should have a study guide with it. So each unit, so exam 1 is typically units 1 through 4, and there's study guides for each unit to help direct and focus your learning. And the course follows our textbook, Human Physiology by Silverthorne. You'll notice in the textbook that the figures that are in the textbook are also used in the voiceover PowerPoint digital lectures that were authored by the faculty instructors so that everything is a common message and you're not seeing a different figure in your voiceover PowerPoint than you would in the in the physiology book. All right. So strongly recommend that you purchase the textbook because there's a tremendous amount of resource in there relative to just the content for reading, a little more information about the figures, and there's also some concept check questions in there that also come with the answers that I'll talk to about in a little bit. That's a great way to test for any kind of knowledge gaps that you might have. So there's a lot of really good reasons on why you would want to get the textbook to help support this course. So what we recommend is that you need to be prepared before you come to class. And in order to be prepared before you come to class, I would either recommend that you listen to the voiceover PowerPoints or you at least read the transcript and look at the slides before you come. It really depends on your learning style, on how you might want to approach that. But I am going to caution you that if all you do is look at the slide piece, the PowerPoint of it, and you don't listen to the audio or read the transcript, you're going to miss a lot of valuable information. That the PowerPoint slides do not contain all the information. It highlights key points. And so you're going to need to either listen to the voiceover PowerPoint and take some notes or make sure that you've read the transcript. So you should at least look at that before you come to class or read the textbook prior to class. The textbook at the end of each chapter has a really great summary, a 2-page summary, and that's always great to read to get a sense of the terminology and just the overall direction of where the lecture is going to go, because that'll give you some insight into how prepared you feel for that unit. Maybe it's a piece of information that you know pretty well, or maybe the topic is something that's very new to you. And so that'll help you decide how much time that week you may need to spend studying that content. And I think a lot of times students often forget or don't realize how much you've forgotten from your prerequisite work. Everyone's taken the same prerequisites to get here, but I think it does depend on when you took those prerequisites. And so you want to be careful that even though you took the prerequisite, that you're realizing, oh, gee, I forgot a lot of this information, because then you're going to have to spend time studying that information so that you can get up to speed with where we might be as we're presenting on a graduate level. So I just want you to think about that a little bit. As far as note-taking, strongly recommend note-taking. I suggest, and the literature supports on this, that people retain information better when they engage in handwritten notes. And so kind of recommended that during class you take notes down as a rough draft. And you might even want to focus on writing down, rather than everything, writing down the things that you don't seem to know or remember. Because sometimes the speed at which we go, it might be hard to write everything down. But you at least want to get a rough draft done. And then you want to go back and you want to redo it. And you want to redo it into a master that has the information that you're going to need, so that you have a good set of notes for studying for your quizzes and exams. Does anyone have any question on that particular type of strategy? What I want to make sure is that you don't think that just reading the material is studying the material. Sure, you have to read the material to get familiar with it. Again, you probably want to try to do some handwritten notes and then make that master. And you want to go back through and you want to have different touch points with the information, so that you're studying the content often and at different time periods. So you want to make sure that you have a strong master that can help you support that activity. So one of the things that I want you to do is think about, I want you to listen. I want you to write down or highlight when an instructor points out an important concept. Like when I'm lecturing, I'll say, this is really important for PTs. This is an absolute must know, highlight it in your notes. And I'm telling you, I'm going to test you on this. I'm saying to you, this is important for you to understand as a PT so that you can take care of your patient adequately. And so you want to make sure that you highlight that, you go back and make sure that you understand those concepts. And most of the instructors run weekly review sessions, so that's a great time, if you're not understanding a concept, to come to one of the instructor-led review sessions and then ask that question, especially if you can't find it appropriately in the book or in your notes, you're still just confused, ask us about it. All right, which means that I think it's important that you attend those lecture-led review sessions. Most of the time we'll ask you, if you have any questions, that kind of thing. Sometimes people in the review sessions bring up something that maybe you weren't even really thinking about. You're like, oh, that's a knowledge gap I have. I'm glad I came to this, and somebody asked that question. Also, sometimes, saying it another way, then it clicks for you. So I think that those are important. I also use with my PowerPoints, I use Mentimeter, which is a platform that embeds questions into the lecture, as well as we post clicker questions, and in your textbook, there are concept check questions. And what's great about all of these are you can, try to answer the question. It lets you know if you're understanding the concepts, if you have any knowledge gaps, and the answers are provided so that you can have well-timed feedback to know what the answer is. And if you're having an issue with it, then you know to ask that question either in one of your study groups or in a tutor group or in a faculty-led review session, or reach out to one of the faculty in an email and say, I've been studying this and not understanding this. And I think that sometimes these questions are important too, because I have students tell me that they kind of feel overwhelmed and they can't even think of a question to ask. They know they need help learning the material and they just don't even know where to start. Or maybe they themselves, as trying to learn, are uncertain how to start, even though they have the study guides and like that. And these questions are a great segue into testing yourself, as well as asking others a particular question on that particular content concept. So I'm going to encourage you to think about utilizing that as a strategy for self-assessment, as well as for asking questions on something that you might not really know. So I think when we look at studying, I think best learning, and the literature really supports this, that best learning occurs over multiple sessions at different points in time. And I'm still going to recommend that you study your most difficult subjects and content when you seem to be able to concentrate the best. You're going to need to study every day, especially topics and content that is more difficult or more unfamiliar to you. And if you're realizing that you forgot a lot in your prereq, you might have to go back and, listen to a Khan Academy or listen to an Amoeba Sister or do some other digital video to elevate your understanding to get yourself to the graduate level so that you can understand the content that we're teaching, because you can't build off of our content if you've forgotten some of that prerequisite content. So, you're going to have to, those are some strategies where people can elevate their knowledge very quickly, especially the Khan Academies. Some of those are only like 10 minutes long, and it can help refresh your memory on things. Also, you want to utilize a study group. I don't think really anyone can get through this program with just individual study. You really need to have a study group. I think the bigger question is knowing how you study and what percentage of your study time do you want to engage in individual versus study group time, because you only have X amount of time to study. And based on your learning style, the percentage on that doesn't have to be 50-50. I'm not advocating spend 50% of your time studying on your own and 50% studying in a group. I think based on how you learn and how you feel comfortable, either as an individual studier or in a group, will decide the percentage of how much time you spend in each of those settings and in trying to learn the content. So I think that's different for everyone. Realize that student support services is available for you and that they offer a lot of different types of support. One of the things that that's really popular is the group tutoring. And so if you've had a quiz already and you didn't perform on it like you wanted to, it takes a little bit of time to get into the group tutoring. So I would encourage you to do that sooner than later. If you think that you're needing some help, please don't procrastinate. Please don't wait until there's large stakeholding in a quiz or an exam that's worth a lot of points and not do well on it. You know, get into tutoring, find a good study group, and make sure that you're getting the best grades you can get. So don't procrastinate. Individual tutoring is, you have to qualify for that. It's not available to everyone. And there is an opportunity for individual tutoring. And then some students need support and help in just how to study and organizational strategies. And sometimes they need more individualized help in that than a group presentation like what you're in today. So although I'm outlining a lot of the strategies that would occur in these study and organizational strategies that would be provided by student support services, I'm doing it in a group as opposed to on an individual basis, but realize that they also help with that, that it's more than just tutoring that they offer. So realize that that's a great resource for you. There's also some counseling that can occur with that if you're having some life events that you think are detracting from your ability to concentrate and be productive in the program. So again, I think one of the common messages is just don't delay. Don't procrastinate on that. Reach out when you think that you might need some help. Okay, so one of the things I want to ask you is do you know how you learn? I think sometimes people have gotten to this point where they're in grad school, but maybe they haven't really focused or really thought too much about how they learn. And the reason why this is important is because the way this course is set up, we're trying to tap into many different types of learning styles. And so how you want to approach the course is so that you get the most efficiency out of your studying. And in order to do that, you have to realize how you learn. So when we look at basic ways that people learn, they're either maybe auditory or visual, kinesthetic, or a read-write person. And so one of the things that you might want to do is you might want to take a learning style quiz. You can just put in learningstylequiz.com, and this is about a 10-minute quiz, and it's free, but it'll tell you what your dominant learning strategy is. So for instance, if you're an auditory learner, then you probably want to listen to the voiceover PowerPoints because you want to be able to hear them. If you're a visual person, then you're probably wanting to look at figures and tables. You probably like the actual PowerPoint better, but remember, I said that you have to look at the transcript, or you have to listen to the voiceover PowerPoint because the slides are just summaries, and I don't want you to miss critical pieces of information that you might capture during the auditory or the transcript piece. All right, if you're kinesthetic, you're that kind of person that likes to learn by using their hands. And so then you definitely are going to want a whiteboard because you're the kind of person that learns by drawing things out. And so you're going to want to draw out figures. All right, and sometimes people are blended in their learning styles, like a kinesthetic person that wants to draw out figures and then talk about them and explain them maybe to themselves or to their study group, that kind of thing. They might also have a visual piece to that too. And so they like to not only see the figure, but they like to draw it out and then explain it. Other people are read-write people. They want to read, they might want to read the transcript, that kind of thing. They want to take more notes. They learn by reading it and then writing it out. So you really have to tap into your best learning style or styles and key in on that as a way to present the content to yourself. So like for me, I'm kind of a visual read write person. So what I would like to do is look at the voiceover PowerPoint, look at the slides, read the transcript, and write some notes from that. I'm probably not that person that can sit around and listen to the auditory piece of it. I would rather read the transcript that and then look at the slide at the same time. And so that's my efficiency and my learning style. So I'm just asking you to kind of identify that. Does anybody have any questions on that, or have you done that in the past? Any questions on how you might want to approach the course from this perspective?
I do have a question. So I know I'm a kinesthetic learner. Besides a whiteboard, what else would be useful? Because I mean, I've obviously wrote, I've read the book, I've watched the PowerPoint, and I feel like I understand it, but I just really have to see it. I mean, is there anything?
I mean, I think when you're kinesthetic, I think you're really that person that sees that figure in the book, and then you want to draw it out and explain it to yourself. You don't want to just look at it and explain it. You want to kind of draw it out and recreate it and then discuss it. I think that's something that the kinesthetic people really benefit from. So I would encourage you to make sure that you're doing that. You like those charts and the arrows and follow the path.
Definitely. Yeah, I'm more of a hands-on person, so that's why patho is kind of hard to me, just because obviously you can't put your hands on anything.
Right. It's not like anatomy where there's a bone and I can put my hand on the bone and I can feel different bony protrudences and I know that they're there. That's why I'm going to encourage you to try to draw out some of the key concepts, because I think that'll help you, whether it's on a whiteboard or on a piece of paper.
Okay, thank you.
Yeah, and then you might want to, you're allowed to take your whiteboard into your exam. So, obviously it has to be clean on both sides when you take it in, but while you're taking a test question, then maybe you can use your whiteboard and draw out some things on the whiteboard after you read the question.
Thank you.
So yeah, you're welcome. So if you haven't taken the learning style quiz, it might be a good 10 minutes of time invested. Okay, so we talked about how we learn a little bit. I think the other piece to it is how do we take the test? So how do we kind of dissect a test question? So I've got two different test questions I want to go over with you today. And this one's pretty straightforward. It's basic knowledge, but the first thing you want to ask yourself, and I usually encourage people to read the test question twice, but what's the question asking? What's the root of the question? This question says, what is the primary ion concentration of the intracellular fluid compartment? So you should be asking yourself, what's the question asking here? It's asking about ion concentration in a particular place. Where's that particular place? It's the intracellular fluid compartment. All right, this is a basic knowledge question. So when we look at this, hopefully when you read this question, you say to yourself, oh, I know the answer. I know what ion that is. And now what I want to do is go down and look at the possible answers and see if the answer that popped into my head is showing as one of the possible choices in this multiple choice question. So, the correct answer is potassium. And so hopefully you were thinking that and you saw that. And so you knew that you got the question correct. So we know in a multiple choice question that one answer is correct. One should be very close. one should be reasonable, and one should be able to be ruled out pretty quickly. And that's how we should focus, and that's basically how your national board exam is written too. That's just kind of how multiple choice questions are written. So part of it is you want to understand the strategy of what's behind the test writer when they're writing a multiple choice question. So let's look at a question that's a little more difficult. And this one is actually right out of one of the board exam, the National Physical Therapy exam. It's an actual old question off one of the boards. So the first thing I'm going to ask you to do is, you want to read the question so you know the whole question, and then you want to read it again. And you're going to ask yourself, what's the question asking? And then know that when you go to look at the answers, that one of them you should be able to rule out pretty quick. One's kind of reasonable, and should usually hopefully narrow it down between two answers that seem fairly close. But there's some little snippet in the question that kind of leans it to the one that's the answer being the best choice. All right, so let's just read this one together. It says, during aerobic training, your patient complains of chest pain during exertion. After a few minutes of rest, the pain disappears. Your patient admits having other episodes of chest pain under similar conditions for the last few months. You take precautions and stop the exercise and refer your patient to their physician because your patient may be suffering from what condition? Okay, so can we take out, what are some of the important pieces in this question? Anybody want to say anything? Excuse me?
Chest pain?
Okay, the chest pain. So you want to ask yourself, there's chest pain, what's the characteristic of the chest pain? What are the conditions under which the chest pain starts and stops?
I mean, it's going to have something to do with the heart, obviously.
Right. So we know it's probably something to do with the heart, but we're like, okay, it's happening during aerobic training. So we know it's happening during aerobic exercise. We know that it happens during a certain level of exertion. And if they rest, the pain disappears. So we know that this chest pain is transient. And we know that what brings it on is a certain exertional level. And then your patient says to you, well, I've been having similar episodes of this for the last several months. So now we know that this isn't acute. It's been happening for the last several months. We know that it is a chronic condition. All right? You realize that it's the heart, and you realize that chest pain isn't good, especially with exertion. All right? So you have, you go ahead and you stop the exercise and refer the patient to their physician. And so when you look at these distractors, all right, the first one you should have been able to throw out, that one that could be ruled out quickly, esophageal reflux symptoms that mimic angina. Well, there wasn't any information that this had any parallel with eating. It didn't say anything about any kind of GI issue or associated with food. It said during aerobic training. So I should be able to, throw out D as an answer right away, okay? And then I ask myself, well, arterial hypertension, that's reasonable, but that's usually not a symptom of hypertension. So although I think it's a cardiac condition, probably the cardiac condition of hypertension is not going to cause this. So now I'm down to, is this a chronic stable angina or is this heart failure? Both of those can be plausible. So I then go up and say, well, this has been going on for several months. That's chronic. It's chest pain. It's angina. It happens all the time with a certain level of exertion. That's what stable, that is saying it's stable because it doesn't happen randomly, it happens under a certain set of conditions. So it's stable. So you would select chronic stable angina. Does that make sense?
Yes.
On how you'd want to sort through that question to come up with B as your best answer.
Yes, ma'am.
Okay. So that's kind of how you want to go about kind of dissecting a question a little bit. So the other thing I did when I was putting together this presentation is I wondered what the tutors said. You know, I was like, okay, you're a student tutor, you're a student, you've gone through the program, you were successful in Pathophys, so to the point that we asked you to be a tutor, and so you've been tutoring these students, and so from your perspective, you know, what would you tell other students that maybe you were tutoring? And here's some of the key points that the student tutors said. One, study often with spaced repetitions. So don't just read it. You got to go back. You got to hit it several different times, and you've got to have repetition to it. They said really focus on note-taking of what you do not know versus trying to write everything down. All right. They also said as far as memory recall, make your own questions. Write down questions with multiple choice answers. Sometimes in making your own questions, it helps you study. If you don't feel comfortable doing that, remember there's the Mentimeter and the clicker questions, and the concept check questions in the book are the textbook driven questions. So there's so many different ways of questions that are already written for you that you can study off of. And if you're struggling with some of the basic concepts, maybe you've forgotten that prerequisite work. You know, the Khan Academy and the Ninja Nerd are great digital lectures that are usually 5-10 minutes. It's a quick summary that can sometimes elevate your knowledge gaps so that then what we're learning in class means a little bit more to you. So, you know, if it's material that you've forgotten or material that you're not as familiar with, you're just going to have to spend more time on learning it. And so you're going to find some units you just know better than others because maybe you've had more physiology, muscle physiology or cardiac or pulmonary, and maybe not as much with, you know, the immune system or the GI system, that kind of thing. So, you know, you kind of have to want to pre-plan for that on how much am I going to have to learn, how much of this is new information for me based on my past experiences. So let's kind of just summarize, all right? First, realize that you're in an accelerated graduate healthcare program and things are going to come at you fast. You want to make sure that you get organized, get a calendar, and prioritize. Get a weekly schedule so you're prioritizing what you need to do, and don't forget about yourself. Realize that life events can affect how you're learning. They can be a distraction. They can take time away from your studies. So be cautious with how involved in that you have to get, and reach out for help if you need to. Know how you learn so you can be efficient in how you approach the course. Come to class prepared. Don't come to class expecting us to spoon feed you. You've got to get in and you've got to at least look over the PowerPoints, read the transcript, read the summary in the back of the chapters we're covering in class, so you have an exposure to the material. You might not understand all of it, but you've been exposed to the terminology and the general picture of what we're going to cover that day, so it's not the first time you've heard it. All right, get a study group and study often. Use the study guide to help you focus. The clicker questions and the Mentimeter questions, especially for me when I write those Mentimeter questions, I'm writing those because to me those are key concepts I want to make sure that you are learning. So, and I post those so you have those. And ask for help earlier than later. Please don't procrastinate. If you feel like there's an issue, we're student first, and we want you to reach out. So I want to know, do you have any questions or anything about anything that we covered in the presentation?
No, ma'am.